Although we've made some changes to Birmingham Women's Hospital, the way that it looks and feels is very much the same way that it did before coronavirus. We've had a very low number of women and babies who've actually become unwell with coronavirus, and none where the illness has been passed between them, which makes us feel and know that what we're putting in place is working to help to keep you safe. Most of the changes that we've put in place are very much the same as what you'll have seen at the supermarket and shops when you go out and about. But don't take our word for it. Take a look, have a look around and see for yourself what it will look and feel like when you come. If you've got a planned admission, then we'll arrange for you to come up to the hospital to have a swab so that we can make the best plan for you when you are admitted. You'll drive up to the station that's outside the hospital where members of our team will look after you. But don't worry, when they make the appointment with you, they'll tell you all about what to expect and where to go. Please don't arrive too early for your appointment. If you do, we may ask you to wait outside. This is so that we can make sure those people who need to be in the building are. This is in order that we can follow the national guidance about social distancing. You'll need to wear a face covering at all times in the building, so we're asking that you come with one to pop on before you enter the building. This could be a scarf or a face mask, but must cover your nose and mouth. When you come through our doors, we'll also ask you a few questions. This is so that we can make sure you are not showing any signs that you are unwell or that may put you or others at risk. Wash your hands and dry them thoroughly before heading in. Please keep to the left as you follow directions to your destination. Pay attention to the signage to support physical distancing, keeping as much distance from other people as possible. All of our staff working in the hospital will be wearing masks, but they're the same compassionate people underneath. We're keeping as many of our facilities open for as long as possible, including our coffee shop and restaurant. All of our facilities, including toilets, are exclusively available for our patients, screened visitors and staff. Please just ask any staff if you need help finding your way around or even if you need support. All our departments have looked at their waiting areas to see how they can limit the numbers of patients waiting at any one time and to reduce waiting times in general by managing appointments in different ways. Seats have been spaced out to ensure nobody waiting comes into close contact with anybody else. There is still plenty of seating, so you won't have to stand while you wait for your appointment. You can expect whoever you are here to see to be wearing a face mask throughout your appointment. It does get hot wearing the mask, so we recommend that you bring a drink with you. If you're preparing to give birth when the time is right, you'll head to the birth centre or delivery suite. Our rooms are a good size, which means it's safe to care for you and your partner to join you. For women in established labour, in a labour room or in our operating theatre, we do not ask you to wear a mask unless you've been diagnosed with COVID or have symptoms that suggest you may have it. We do, however, ask your birth partner to wear a face covering at all times. Staff will be wearing full personal protective equipment during your birth, so that both you and they are protected as they support you closely. We follow national guidelines when it comes to the visiting on the wards, so it may be that your partner isn't able to join you. Please keep a very close eye on our website where we will update the situation as and when the new guidelines come out. If you need to stay with us, then you'll be taken to one of the wards where we've made sure that there is plenty of space between the beds. If you need to stay a while, your family or friends may be able to drop some belongings for you at the main entrance, where we have some helpers who can then bring your belongings to you on the ward. When it's time to go home, you might have asked somebody to come and meet you. We will make sure you know where they can meet you, and there will be help available if you need support. Please remember, if we have asked you to come for a consultation or for care, it is safe for you to do so. Your health is our priority and we are here for you. Your care is not a burden. We are caring for very many women, babies and families every day. We are here to do the best we possibly can and we are proud to care for you. Please remember, we are here to be by your side.